ideally, these measurements should be taken passively. Oftentimes with the lower extremity, because it is a heavier limb, you'll assess passively. And then when you're getting your goniometer lined up, the patient might actually be activating muscles a little bit. It's more about find that passive range and then hold it there the best that you can. And again, it should ideally be completely passive, but because the lower extremity is a little bit heavier, as long as you've gotten a very accurate measurement when you're doing your end feel assessment and hold it there, then place the goniometer and you'll have an accurate measure of the joint that you're testing. So we're going to check hip flexion. So for hip flexion, you want one hand on the ASIS to monitor for pelvic motion. So scooch a little closer to me first of all. So again, body mechanics really important. Make sure that the patient is very close to you. And I'm going to move this table up a little bit so that I'm not bending over so much. Okay, so one hand's going to monitor the ASIS. One of the biggest mistakes I see when people are doing this testing is that they miss where the pelvis starts to tilt. So if the pelvis starts to go into a posterior pelvic tilt, they're at their end range of hip flexion range of motion. So you really need to monitor what's happening at the pelvis when you do your hip flexion range. Okay, so your thumb's gonna monitor that ASIS. You're gonna pick up the leg here. And again, she should be totally relaxed. And you're gonna bring her up into flexion. And when I start to feel that pelvis want to go into posterior pelvic tilt, oh, we should get the camera. Sorry, guys. Oh, it's blurry. There we go. Okay, sorry. Okay, so hand on the ASIS, bring them up into hip flexion. And right when you start to feel the pelvis start to tilt posteriorly, that's your end of hip flexion range of motion. Okay, so you apply a little bit of overpressure to get a sense for the end feel. A typical end feel for hip flexion can either be soft or firm. Okay, so then bring them back down. I would guesstimate that she's probably at about the full range of 120. So I'm going to set my goniometer up with that range of motion measure. And our goniometer is going to be aligned with the greater trochanter of the femur. So that's where your fulcrum goes. Your stable arm is going to be aligned at the mid-pelvic, basically the middle of the iliac crest. So if you find the iliac crest, the top part of it, you want to be right at the midline of that pelvic bone. And then your moving arm is going to be aligned with the lateral epicondyle of the femur. So those are your bony landmarks. So again, I'm going to set her up at that 120 mark. I'm going to bring her back up. Okay, there's where she starts going to posterior pelvic tilt, so I hold her there. And then set up my landmarks. So greater trochanter, midline of the pelvis, and lateral epicondyle there. Okay, so she's at 117, so almost 120, almost full range. Okay, so that's hip flexion. While we're in this position in supine, we'll do abduction and adduction. So for adduction range, for the screen, we lifted the limb and just kind of got a general sense for how it moved across the body. But to get a true valid range of motion measure of adduction, we want the limb to stay on the flat plane, so no flexion extension, just in neutral. So you're actually going to move the opposite limb away so that you have space to bring the limb into adduction. So we stabilize at the opposite ASIS, draw the leg across, and try to keep it relaxed if you can. Good. Okay, and that's about where I start to feel her end range. I apply a little overpressure to get a sense for what that feels like. Again, for this, it would be firm typically, usually because it can be from capsular tightness, or it can be from soft tissue tightness at the gluteus medius or gluteus minimus. So once you get there, you can actually just place the limb down on the table. That's kind of the nice thing about the adduction range. You don't really have the support as much. And then for the goniometer alignment, fulcrum is going to go on the ASIS. The stable arm is going to be aligned with the opposite ASIS. so it's just going across her pelvis. And then we're aligning the moving arm with the midline of the femur. And you can use the patella as a landmark. And for that she's measuring at about 20 degrees of adduction range. The landmarks are the same for abduction, so let's bring it back to neutral. Again, for this one, it's going to be much easier if you guys bring the limb in between you and the table, so that you can support and then handle the goniometer at the same time. So try to keep this relaxed. Stabilize pelvis. Bring her out. When I feel her pelvis want to start to move, that's her end range. I apply overpressure. Again, this is typically firm, usually from soft tissue tension in the adductor muscle group. And then I'm going to align my goniometer with the same landmarks we just did. So we have ASIS for the stable arm and the fulcrum. And then the moving arm is aligned with the midline of the femur to the top of the patella. And you can see as I kind of just let her hang out, she went into external rotation. You do want to make sure that you keep that knee facing up towards the ceiling. You okay?
Yeah.
Okay. Just feel tight?
Mm-hmm.
Yeah. And for that one I got around, let's see, it was 28 degrees. Okay. So abduction, adduction, flexion. And let's go ahead and do extension too. So go ahead and flip onto your stomach. Okay, so we're testing extension in prone. This one's a little bit trickier because a lot of people are actually quite tight in their into hip extension. Scooch a little closer to me. So you want to be on the iliac crest here on the side to monitor for the pelvis to go into an anterior pelvic tilt when we're testing for hip extension range of motion. So once you start to feel that motion happen in the pelvis, that's the end of your hip extension range. So you're going to take the limb, try to relax it the best that you can. Good. I'm monitoring that pelvis, and I'm bringing her up until I start to feel the pelvis tip anteriorly. Okay, so right about there is where I feel it. So I get a sense for what that angle might look like. Let's say maybe around 10 degrees. Now, why would I keep the leg in extension versus flexing her knee and coming up?
You might have just do the hip flexing.
Yeah, got it. Nice. Yep. So, just to repeat that, so if we were to test this with her knee bent and I were to try to lift her up, let's see, yeah, and I already feel resistance here. So her hip flexors, if they're tight, might be being put into a passively insufficient position and limiting the hip range of motion. Right? So that's why we want to make sure that the knee is an extension when we're testing for hip extension range of motion. Okay? So then, in terms of your landmarks for hip extension, the stable arm, just like for flexion, is going to be along the midline of the pelvis. The fulcrum is going to be over the greater trochanter. And then your moving arm is going to be aligned with the lateral epicondyle of the femur. Okay, so again, I'm going to set my goniometer first. I thought it was about 10 degrees. Okay. And check her pelvis. Bring her up into that range. So right about there is where I feel her pelvis want to go into an anterior pelvic tilt. And then I'm actually going to come from underneath so that I can stabilize her here. And then I'm going to line up the goniometer. And again, lateral epicondyle, greater trochanter, and midline of the pelvis. And yeah, like 11 degrees is where she go. Okay. So once you have to measure with the goniometer, you don't have to stabilize the pelvis quite so much, right? So you just have to make sure you get that accurate range to begin with, and then switch your hand placement so that you can get the goniometer on your correct landmarks. Cool?